patients. I'm San Francisco Mayor London Breed. I'm joined today by the Department of Public Health, Dr. Phillips, and joined by the Department of Human Services, Trent Rohr, as well as the Department of Homelessness and Housing, Abigail Stewart-Kahn, the Police Chief, Bill Scott, and you'll be hearing from some of them in just a moment. As of today, we have 1,490 reported cases of those infected in San Francisco with COVID-19, and sadly, we have lost 23 of our residents here in our city. Just a reminder that you can find out more information at datasf.org/COVID-19, our tracker with a number of details around neighborhoods, around race and ethnicity, and other information on this. So much for your patience. I'm San Francisco Mayor London Breed. I'm joined today by the Department of Public Health, Dr. Phillips, and joined by the Department of Human Services, Trent Rohr, as well as the Department of Homelessness and Housing, Abigail Stewart-Kahn, the Police Chief, Bill Scott, and you'll be hearing from some of them in just a moment. As of today, we have 1,490 reported cases of those infected in San Francisco with COVID-19, and sadly, we have lost 23 of our residents here in our city. Just a reminder that you can find out more information at datasf.org/COVID-19, our tracker with a number of details around neighborhoods, around race and ethnicity, and other information on this tracker that we will continue to update. In addition, there is information on this tracker as well regarding our hotel rooms and the number of hotel rooms that are available and also occupied by homeless individuals, our public health and our public safety workers, and so lots of great information on the tracker. Today, as I'm sure you know, the Bay Area County Health Officers announced additional details regarding the stay-at-home order, which has been extended through the month of May. The new guidelines include outdoor businesses, the ability to open outdoor businesses like flea markets and car washes and gardening services, other outdoor recreation like hiking and fishing and golfing. These are things that can be done through social distancing, and it's just providing additional opportunities for people to not only have some flexibility but get back to work. And speaking of getting back to work, they've also provided the opportunity for construction to resume in our city. That's all construction projects. And this is really great that we are at this point, but I want to be clear that we still have a very long way to go. And the work that the Economic Recovery Task Force is doing to work with the Department of Public Health to provide guidelines for various industries as we look into the future and what it will mean once we are able to truly reduce the curve and get back to the lives that we know and love. We know that there will be some real changes. And so our goal is to start working on what those changes might be and how we can provide guidelines in advance so that so many of our businesses in San Francisco are prepared when we are able to resume business. And I know that this will be a gradual undertaking, and we appreciate, again, your patience and your cooperation as we deal with this very challenging time. I'm committed to not only getting through these next few weeks, but also making sure that we are able to provide you all with a little more guidance, a little more certainty and understanding about exactly what could potentially be available. We know that so many of you are anxious to know that if you are able to go back to work, what will happen with schools, what will happen with children, what will happen with elderly parents, or exposure for yourselves, and those are the kinds of things that we want to make sure we have the answers to as we gradually begin to reopen various sectors in our city. So again, thank you for your cooperation and thank you for your patience. I want to just talk a little bit about how excited I am that construction is able to resume in San Francisco. It not only means opportunities for the people who are working in this industry to go back to work. And again, there are guidelines that have been put in place to keep workers safe. It provides the opportunity to continue what we know is important construction work around housing. Housing production is something that is necessary because when you think about it, even though we're in the midst of a public health crisis, we were already experiencing a huge homeless challenge and the need to make sure that we are not stopping housing production because of what will be needed on providing us the ability to move forward and to make sure that we have this much needed housing. It's so important to move forward. And so we know that this has been a problem in our city, and it's something I've been pushing for. This challenge of providing housing and the issues around homelessness because of this crisis could potentially get worse. And this is why it's so critical that we continue to build housing. And so I'm excited about this, and I know that this will make a real difference in our city and in the Bay Area. Housing shortages, as we also know, lead to higher cost, and higher housing costs leads to more people becoming homeless. From this population, they cannot just stay at home because they don't have a home. We see this playing itself out all over our city with the number of tent encampments and the number of homeless people who are there. And so far, we've placed almost 1,000 people into now vacant hotel rooms, which have been an incredible logistical challenge and continues to be. But as we've talked about before, we also need hotel rooms for healthcare workers and some of our frontline workers who are out there working every single day, essential workers who are putting their lives on the lines, because we don't want to risk them infecting other people in their families. In addition to securing and staffing hotel rooms, we're also creating alternative shelter locations, including 120 RVs and trailers at Pier 94 in the Bayview Hunters Point. This site will provide a safe place for people who are homeless in the southeast part of the city. And I want to be clear that these RVs will serve the Bayview Hunters Point community, and Trent Rohr, Executive Director of Human Services, will speak more in detail. But the hotel rooms that we are providing are for people who were homeless in San Francisco before this crisis. The RVs that we are providing in the Bayview Hunters Point are for the people of the Bayview Hunters Point community. And we are only going to serve during this crisis, and I want to be clear because I've heard a lot of conversations, a lot of talks, and a lot of feedback from people who are out there on the front line where people are showing up in San Francisco from other places and asking where their hotel room is. That's a real problem for me because, again, we already have a very challenging problem as it relates to homelessness as it is, and I want to get the message out loud and clear that the people who are already in our system of care, we have a coordinated entry system to help support our homeless population. If you are not in that system, and we're not in that system as of the beginning of this pandemic, then we will not prioritize you over people who have been waiting for housing, for shelter, and for the resources that we have available. You will not be prioritized over them. So I want to make that loud and clear. Only people who are currently in our homeless system of care may qualify for these rooms, and only the people who are in the Bayview Hunters Point or other folks who are in our coordinated care system may qualify for the RVs and trailers that we have available. No one from other cities should be coming to San Francisco expecting that they're going to get prioritized over the people who are here. And to be clear, we have enough challenges with trying to provide services and support to our existing residents. And we are most likely not going to be able to serve everyone as hard as we are trying to do exactly that. So I just want to be clear so that we can make sure that that word gets out, because sadly that is what we see happening and playing itself out on our streets. And what I want to also talk about is density and crowding, and how there's a national conversation around the fact that places that are more dense, that have a lot of housing, are places where there are real challenges with the virus. In San Francisco in particular, we have been able to not necessarily reduce the curve, but keep it relatively flat as a result of the work that we have all done together. But we also know that the lack of housing, the inability to have places for people to live where they have their own bathrooms and their own kitchens, and they're not sharing these congregate living spaces. And more importantly, we know that the cost of living has made it difficult for families who are, in some cases, living with one or two families and extended family members. Those are the kinds of environments that make it possible to spread the virus quickly, and the conditions that people sometimes live in are very challenging. And this is, again, why the need to build more housing and to have more opportunities for people to not be in units where there is crowding or overcrowding is important, especially during a pandemic, as we can see. We've also seen how our low-income communities have been hit harder, in part because people in those communities are often forced to live with multiple roommates or other family members in the same unit. And this is what I mean by the housing impacts. The fact that we are not building enough faster is having a tremendous impact on our city, although in comparison to other cities, San Francisco is relatively flat. I mean, we are the second densest city in the country, yet we have not experienced, close to the impacts that other cities who are far less dense than we are have. So I want to dispel the myth of the need to not produce more housing as a result of this pandemic. It is a serious need in our city, and I want us to continue to move in this direction. And it's one of the reasons why I, along with President of the Board of Supervisors, Norman Yee, we introduced legislation to move forward the Balboa Reservoir project. This project will create thousands of new jobs and permanent jobs, and 1,100 new homes, with 50% which will be affordable right next to City College. There will be housing for teachers, for families, for low-income residents, a great new addition to the neighborhood near public transit and near City College. This is absolutely incredible, and this is what we need to do. It's really why I am very surprised and extremely disappointed that the Board of Supervisors yesterday decided to continue the Mission Rock project. The Mission Rock project, which provides 1,200 homes, 40% of which are affordable, and 13,000 construction jobs and over 10,000 permanent jobs. When we're thinking about what's happening with this pandemic, we can't wait around to move these projects forward. People have lost their jobs. Over 60,000 San Franciscans have filed for unemployment, and we anticipate that 40,000 more will. We can't stop our economy. We can't stop moving forward. People are going to need access to employment opportunities, and people are going to need places to live. So it'd be interesting to hear exactly what the reason is for why this very important critical housing and jobs project was delayed by the board, because this does not help our city move forward. Finally, I want to talk about the support we announced yesterday for workers. In San Francisco, we have a law that requires employees who don't provide insurance to pay into a fund that gives workers access to funds for health spending. And you think the city's bureaucracy is challenging. I mean, this program, which is meant to help workers, and the challenges that they have had in maneuvering this system has made it difficult for them to access money that they're entitled to. And we're not just talking about a few dollars. We're talking about, in this particular case, $138 million. It's just sitting in healthcare accounts, and because of restrictions and bureaucracy, it's too hard to spend. And yesterday, we were able to announce what we did to fix it. And I will tell you that this is something we have been working on a long time, and thanks to the City Attorney's Office, the Office of Economic and Workforce Development, some people from labor and other great minds, we were able to come up with a really great solution so that we can get the money from this account directly into the hands of the people who need it the most. And so we are going to do just that. Every single person who owns one of these accounts, and there are over 100,000 accounts, will not now be able to access this money. And we will make it easy and quick for them to get it. This is really something that will help tremendously with what some workers, and in many cases, these are the workers who have most likely been laid off from work and could use what could amount to anywhere on average $1,300 per person. So I'm really grateful to all of the people who worked on making this resource available. As we deal with this real challenge around public health, simultaneously we must ensure that the things that we are able to do and provide, we need to do it. People need to work, and they're going to need jobs when this is over. People are going to need to have places to live. We're going to continue to need to deal with the challenges around homelessness. And so this will be very difficult and require some very difficult choices. An estimated $1.1 to $1.7 billion budget deficit is nothing to sneeze at. And so as we are making decisions today, we have to be mindful of that and what that means to the success of our city in the future, the success of our economy in the future. And those are the reasons why these housing projects are so critical, the job opportunities that they create are so critical, our work to support our existing residents, including our existing homeless population, and to not increase that significantly is so critical. It's why we have to draw the line somewhere, because we don't have an endless pot of money available to serve everyone who needs it. And that is going to be our challenge as we go into the future and make the decisions we need to make around public health and safety and our economy. It's important that we do everything we can to support our existing workforce, to support our existing homeless population, and to get through this pandemic together. So with that, I'd like to introduce, Dr. Colfax is not with us today, but Dr. Phillips from the Department of Public Health will be providing an update.
Good afternoon. I'm Dr. Susan Phillip, Director of Disease Prevention and Control and Deputy Health Officer. Thank you, Mayor Breed. Today, there are 1,490 San Francisco residents with confirmed cases of COVID-19, and a total of 23 San Franciscans have died. I send my condolences to their loved ones. Mayor Breed also begins her remarks with these numbers as a way to honor those who have become sick and those who have died, but also as an important reminder to us all. Even though we have made tremendous progress as a community to slow the spread of the coronavirus, it is still here. It can spread as easily as it did a month ago, and it will thrive if we let it. Today, we announced that when the current stay-at-home order expires Sunday night, a new one will take effect immediately. That new order will last through the end of May, giving us time to build the systems we need to support our recovery. I know this is hard. I greatly appreciate the sacrifices everyone in San Francisco and the greater Bay Area have been making. When we think about the family and friends that we're missing, we must remember they are the very people we're protecting by staying apart. When we think about the jobs that are changing or even lost, we must also remember our economy would face even greater setbacks if we did not slow the spread of the virus. And we are slowing the spread of the virus. We have saved lives. We have to keep it up. Our goal is not changing. We want to slow the spread of this virus and see San Francisco and the Bay Area recover. Since January 21st, when the San Francisco Department of Public Health activated its Department Operations Center, we have made preparing for and responding to the coronavirus our top priority. Since February 25th, when Mayor Breed declared a local emergency, we have mobilized the entire city to slow down this deadly threat and to keep our health system stable and ready to care for all who need it. Since March 16th, when 7 million people of the Bay Area joined the fight, we have stayed home to protect one another. Today, we renew our commitment to the fight. We will continue staying home, continue covering our faces when we have to go out, and continue to keep 6 feet away from people outside our households. Yet, we will also make a few minor modifications when the order takes effect on Monday. The new orders allow for some lower-risk outdoor jobs and activities to resume. For example, as the mayor said, all construction may start again as long as each project follows the safety protocols in the order. Certain outdoor businesses can open. That means nurseries and gardeners, for example. It does not mean that a restaurant can open its outdoor patio. We can get outside for exercise, and the city has closed roads in Golden Gate Park and McLaren Park to make that easier. But we still can't share equipment, whether that's a playground or a basketball, or have physical contact with anyone outside of our households. While San Francisco and the Bay Area keep up the good work that has gotten us this far, here's how we at the Health Department and in the city government will be preparing for the future. We will continue to follow the science, data, and facts. We will continue to build out the public health infrastructure to support a gradual reopening and eventual recovery. We will be watching 5 key indicators in the Bay Area and at a state level to track our progress. These are the questions we'll be asking. Number 1, is the number of patients in the hospital with COVID-19 decreasing or staying flat? Number 2, do we have enough of the critical personal protective equipment, PPE, for all of our healthcare workers? Number 3, are we expanding our testing capability to meet the need, especially for people in vulnerable populations? Number 4, do we have the capacity to investigate every case of COVID-19, to trace each person's close contacts, and to isolate and quarantine the people that need it? And number 5, is the total number of cases of COVID-19 in San Francisco and across the Bay Area decreasing or staying flat? As we expand testing, we expect the number of cases to increase at first as we are doing more of this testing. We'll be looking at the rate of positive cases to help us gauge the spread in the community. Once we've built out our full testing program and have increased access to testing, we'd then be looking for the cases to flatten and go down. We've been laying the foundation for recovery from day one, and testing is really an important part of that strategy. We have expanded testing from when we first began testing in our public health laboratory on March 2nd, and will continue to increase testing in San Francisco. To date, we've collected close to 18,000 test results and expanded testing criteria as supplies permit. Today, we are able to test anyone with any symptom compatible with COVID-19, as well as people without symptoms we find through contact tracing and investigations. The next steps in our expansion of testing will include people living in congregate setting and healthcare workers. And we're working with our partners, such as UCSF and the Chan Zuckerberg Initiative. There's research underway that uses testing to help us learn more about the prevalence of the virus in our communities. 3 recently announced or even started projects will test residents in the Mission, a random sample of the Bay Area, and healthcare workers. Each of these will provide important data and insights to help us see a clearer picture and make well-informed decisions. We are also getting ready in other ways. We are learning everything we can about this virus, developing more sophisticated responses to outbreaks, and training a small army of contact investigators. We're working with the Human Services Agency and the Department of Homelessness and Supportive Housing to provide safe housing in hotels and shelters for people experiencing homelessness with and without COVID-19. And we must continue this focus on our vulnerable populations, as they will remain at highest risk from the virus as we start to open up. That means people who are over 60 or with certain chronic health conditions. We must continue to prioritize them, and people living in congregate settings, such as long-term care facilities, homeless shelters, SROs, and jail. As we look ahead to our renewed stay-at-home order, let's keep these vulnerable San Franciscans in mind. Let's remember that the virus exploits long-standing inequities. Let's work together to protect everyone we can. Thank you for continuing to stay home, for staying 6 feet apart, for covering your face when you go out, for washing your hands frequently. Some of these might seem like small gestures, but together they're making a big difference. We are making a big difference. Let's use the next month to get these habits all firmly ingrained so that we can continue to reopen as safely as possible. Thank you. And I'll now turn the podium over to Chief Scott.
Good afternoon, everyone. Again, I'd like to thank our Mayor, London Breed, for her outstanding leadership during this challenging time, and also our Director of Health, Dr. Grant Colfax, and his leadership team, including Dr. Phillip, for their leadership. We continue to staff to help prevent the spread of COVID around the city. Our officers are out in parks and some of our more popular spots, and they will continue to remind people about social distancing. In some cases, we provided face coverings to help people comply with the public health orders. We have received complaints regarding alleged violations of the public health orders, and those complaints are taken seriously and investigated. We're finding, as I've said in previous press conferences, that the vast majority of San Franciscans are cooperating and complying with the health orders. But we have continued to cite individuals who have flouted the order and who, after being warned, continue to violate the order. To date, we have 19 citations that we've issued. That's up several citations from the last time I spoke. The breakdown of that is 10 businesses and 9 individuals. We've admonished or warned a total of 86, or we've issued 86 warnings and admonishments. And as I've stated before, those incidents are incidents in which we have taken reports. That breakdown is 52 businesses and 34 individuals. You can visit our COVID-19 website on the SFPD's webpage to learn more details about our enforcement protocols. We continue to use a path of progressive compliance, and what that means is education, asking for voluntary compliance, warnings, and citations when necessary. And we're committed to community policing and have worked with Director Cheryl Davis with our Human or HRC and other community advocates in trying to get the community with us to help spread the COVID-19 virus, or help prevent the spread of COVID-19 virus, I'm sorry. And that has been largely effective. We want to continue that path, and again, when you see our officers out there, we will be engaging with the public, and we're going to do everything we can on this weekend and moving forward to help prevent the spread with this latest renewal of our public health order. We're glad to work with the community, and I'd like to specifically thank again Director Cheryl Davis and many of the other community stakeholders who have been working with us and other city entities to help prevent the spread of this virus. Now I'm going to turn to crime, and I'll give a brief overview of crime. We're still seeing decreases in crime overall, 19% decrease in violent crime, 24% decrease in property crime this week, and a 23% decrease in overall crimes, which equates to 142 fewer crimes. But we have had some issues that I want to point out to the public, because we're going to need the public's help to make sure that, number one, we look out for each other, and secondly, when you see crimes, we still need you all to report crimes. A couple of things I want to make note of. Year to date, we actually have a two homicides above where we were this time last year. We've had 14 homicides year to date. We were at 12 this time last year. Also, a disturbing trend that we're seeing is we've had 4 elderly victims robbed, some at gunpoint, over the past 11 days. These were all women. They were all robbed of their purses, and this is just simply unacceptable. So I ask all of you to please, let's look out for our most vulnerable population, our elderly in our city, and let's not have this happen to our most vulnerable population. These folks were, in some cases, violence was used. They were thrown to the ground. Like I said, a couple of them were at gunpoint. Our victims were ages 85, 69, 70, and 84, and that's simply unacceptable. We have enough challenges in our city with the COVID-19 pandemic, and this is just something that we cannot tolerate. So look out for your neighbors. Report crime when you see it. Call 911 if you see things that look suspicious. Text 911 if you can't make the call. But we need these crimes reported, because we have to get on top of this and make sure that we don't have people in our city victimized. We've also seen a couple of shootings that are very concerning, including one overnight in the Bayview, Hunters Point area, where over 100 rounds were fired. Now, nobody was hit, thankfully, but this is, again, unacceptable. Our investigators are working hard to make sure that we try to solve this crime and put these folks where they belong, and that is in jail. But we cannot allow this type of violence in our city. So although crime is down, we do still have challenges that we need to tackle, and we're going to need the public's help in working with us to make sure we keep our communities safe. We've continued to investigate reports of burglaries in our city, and as I've stated in previous conferences, crime overall is down, but we have seen an uptick in burglaries across the city, particularly commercial burglaries. So our officers will be on patrol, as we have been. We've made arrests on several of those burglaries, and to date, we've had 34 instances of bookings where additional charges of looting have been added because these burglaries occurred during a public health emergency. And I want to again thank the district attorney and his office for working with us on that. This weekend, moving forward, tomorrow, Thursday, and through the weekend, I want to remind everyone that if you have to travel, travel only when it's necessary and essential, act responsibly, and maintain a social distance of 6 feet. Please wear your face coverings. We will again be out in the hot spots this weekend, and we're going to enhance that deployment this weekend to make sure that we're both educating the public, but also for those people that aren't complying, we have to go to a more aggressive nature on making sure that we get compliance on social distancing and the wearing of face coverings. So we're going to be out and about moving forward as we have been, but we're going to step it up a notch. I want to thank all the San Franciscans and people who come to our city to work and visit for their compliance up to this point. And we want to continue to keep the momentum going and prevent the spread of this virus and flatten the curve. So again, I ask for voluntary compliance, but know that the San Francisco Police Department is out there. We're going to be engaging and continuing to engage, and we need your assistance to make sure that we stop the spread of this virus. Again, I want to repeat the crime reporting numbers as I close. For those individuals who have a non-violent or crime that has occurred where you don't need immediate police services, please call 415-553-0123, or you can also utilize our 911 or the San Francisco Police Department website to file a report or to request a report. Again, thank you all for your cooperation, and let's keep our momentum going so we can stop the spread of this virus.
Good afternoon, everyone. I'm Trent Rohr. I'm the Executive Director of San Francisco's Human Services Agency. As I've spoken about before, the Human Services Agency's role in our citywide emergency response includes provision of mass care and shelter. And from the onset of this crisis, our mayor and city agencies have prioritized safeguards for populations who are most vulnerable to the coronavirus, including our homeless residents. We're following the latest guidance from public health experts to help minimize exposure for those who do not have adequate housing, to safely shelter in place, and to ensure that there are enough beds in our hospitals to treat patients with COVID-19. And to this end, we've focused not only on improving the health and safety, as I've said before, inside our homeless shelters and our navigation centers, but also on moving individuals who are at heightened risk due to age or due to underlying health conditions from our shelters, from our streets, and from our hospitals into hotel rooms. San Francisco continues to adapt to the needs of our residents and adhering to public health guidance at a pace that we have never seen before. I'm incredibly proud of the achievements of our city workforce, our partner agencies, and under the leadership of the mayor, to provide thousands of hotel rooms to some of our most vulnerable residents. With the addition of our alternative housing program dashboard to the city's open data tracker, the public will have better insight into our accomplishments towards providing temporary housing for those in need at this incredibly difficult time. As of today, we have 2,741 rooms under contract at 19 hotel locations throughout San Francisco. The city has moved over 950 people from shelters, the street, or hospitals into hotels, thanks to the careful guidance and coordination from our partners at the Department of Public Health and the Department of Homelessness and Supportive Housing. And I want to emphasize, and to clear up any misunderstanding, that the city continues to implement our hotel plan, and we continue to bring hotel rooms and other housing options online to meet the needs of these vulnerable populations. As I said, we have 2,741 rooms currently under contract, and we are currently in active negotiation with 14 hotels, totaling 2,153 rooms. But it's important to note that these are all in the negotiation stage. They're at different phases of the negotiation, and some are farther along than others. And from our experience, we know that even if we move far along in a negotiation, sometimes we cannot come to an agreement. The mayor mentioned Pier 94 and the trailers and recreational vehicles that we are going to activate, and I want to provide an update and some detail on that today as well. In March, as the city continued to strengthen its response to reduce the spread of the coronavirus, we announced the leasing of recreational vehicles to provide indoor spaces for homeless individuals to help protect them from COVID-19 and to help protect the surrounding communities. The city is now operationalizing a temporary shelter utilizing these leased recreational vehicles, in addition to new trailer resources provided to us by California's Office of Emergency Services. 29 recreational vehicles and 91 trailers have arrived at Seawall Lot 344. This is known as the Backlands at Pier 94, in order to provide indoor shelter for vulnerable homeless individuals who are living on the streets or in shelters in District 10, which includes the Bayview Hunters Point community in the southeast sector of the city. I want to give a huge thank you to the Port of San Francisco Commission for approving our land use agreement for this critical need last night in a unanimous 5-0 vote. Following the assessment of several public lands, the city selected this location for the RV and trailer deployment because it provides land management, utilities, and rent relief through a partner city agency, adequate acreage for fire suppression, it's over 3 acre site, jurisdiction of San Francisco law enforcement, and a direct benefit to people in the neighboring communities, which I want to speak to now. We've come to understand that across the nation, people of color and low-income communities have been hardest hit by the coronavirus. Sadly, we know that these disproportionate impacts are also found here in San Francisco. We've heard from Dr. Colfax and the Department of Public Health that locations in the city that are most affected by health disparities, income inequality, and structural racism are also the most affected by the pandemic to date. This data trend of positive cases in our communities of color demonstrates the importance of the city's ongoing focus on equity and efforts to support vulnerable populations during the coronavirus response. During yesterday's Port hearing to approve the use of the site, Port Commission President Kimberly Brandon characterized District 10 as ground zero for the coronavirus in San Francisco. This district has the second highest rates of those experiencing homelessness in the city, more than 1,800 people, the majority of which are living unsheltered. We hear the community's call to bring forward immediate solutions and strategies to address these inequities. The new shelter location will provide an essential temporary housing resource for at least 120 homeless individuals in the southeast sector of the city who are living on the streets or in shelters. We will prioritize those who are age 60 or older, or who have underlying health condition which make them extremely vulnerable and susceptible to COVID-19. By prioritizing people experiencing homelessness, the shelter site will not only help prevent vulnerable people from getting infected, but also will help reduce the spread of coronavirus in the community. The temporary shelter site plan for Pier 94 will be developed and managed by the Human Services Agency, the Department of Public Health, and the Department of Homelessness and Supportive Housing. Services on site will include medical and supportive care, 24/7 site monitoring and security, as well as meals and animal care. We're drawing on the expertise of our healthcare professionals to implement safety protocols and screenings that will continue to protect the guests from the spread of coronavirus. Similar to our leased hotels, we want to provide people with everything they need to safely shelter in place. And while the location does not have any immediate residential neighbors, we're approaching the development of this temporary shelter in a responsible way, addressing the safety and health concerns of the surrounding port tenants and the surrounding community. I want to express our sincere gratitude to our partners at the port for preparing the staging area and the utilities. All of the trailers and RVs have been delivered and are on site now. We anticipate the shelter being ready to accept guests next week, and it will operate throughout the duration of San Francisco's declared health emergency. We've said before that our capacity to contain the coronavirus and flatten the curve to stop the spread depends on our ability to protect all San Franciscans. Response to this unprecedented pandemic will require compassion from every community across San Francisco to step up and take action. This shelter is an important part of the larger city effort that we continue to implement to provide equitable temporary housing solutions for vulnerable populations in need during the stay-at-home order. I'll now be available for questions.
We will begin the Q&A portion with questions for Director Trent Rohr, Human Services Agency. Director Rohr, this question is from Laura Wienis, San Francisco Public Press. Is there still a plan to lease 7,000 hotel rooms for first responders and vulnerable or COVID-19 positive homeless San Franciscans?
As I said in my remarks, the city continues to implement the plan that we announced 7 weeks ago. I don't know, and I'm not aware of an announcement that went out that said we were ceasing this plan, despite comments in the community. We continue to implement this plan. We've brought online over 2,700 units and are in negotiation with 14 hotels, totaling over 2,000 hotel rooms.
And can you provide an update on reaching that goal and projected timeline for filling these rooms?
It's difficult to project a timeline. Each hotel has to be negotiated individually. Sometimes the owners are local, sometimes they are on the East Coast, sometimes they are international ownership groups. Each contract has provisions unique to the hotels. It's difficult to estimate the time for negotiation. In addition, we've said before, once the hotels are under contract, it takes a number of days to secure the appropriate staffing, supplies, and then to move individuals in the rooms. So I can't give a definitive timeline on when we will reach our goal of 7,000. What I can say is that we have brought on, as I said earlier, 2,741 rooms at 19 hotel locations and are in negotiation with 14 other hotels totaling 2,153 rooms. It's also important to note that the response to this pandemic requires multiple housing solutions. In addition to the hotel rooms, I just talked about the 120 RVs and trailers. In addition, we have 643 beds at congregate sites that are under development to provide resources and places to shelter for folks who have passed through their coronavirus, passed through their COVID phase. They're now no longer infectious and will be placed in congregate shelters. In addition, we are planning for sites for COVID-positive individuals who need more intensive supervision and medical support in a congregate setting.
Thank you, Director Rohr. The next questions are for Mayor London Breed. Madam Mayor, the first question is from Kathy Novak, KCBS. Immigrant and undocumented workers are calling for more assistance beyond the $500,000 from Give to SF for $200 grocery gift cards. Will more help be available for undocumented communities?
We actually have identified around $6 million for undocumented people who have been laid off, as well as many of our low-income families. And we are also working on philanthropic support for this particular fund that will help around food security. And I'm really grateful for what we've already done and what we will continue to do here locally, as well as the work that the governor has done to make resources available from the state. Because again, we know that so many of our undocumented workers and some of our low-income families may not qualify for federal benefits. And so it's important now more than ever that we provide those resources, and we definitely plan to.
Thank you. The next question is from Tricia Thadani, SF Chronicle. Mayor Breed, the Board of Supervisors is exploring legislation for sanctioned tent encampments in open spaces in the city. Are you open to the idea? Why or why not?
So we have already began exploring locations for sanctioned tent encampments in the city, and we want to, again, make it clear that our priority is for the people, the homeless people who are have been in San Francisco before this pandemic, and the priority has been our hotel rooms, dealing with our challenges with our shelters, making sure that we are focusing on our vulnerable populations, the trailers that we just announced today. So moving full speed ahead in trying to make sure that we are meeting the need, and in the process, we have identified a number of locations that we are seriously considering, and as soon as we are able to get those up and running, we will.
Thank you, Madam Mayor.
Thank you.
The next set of questions are for Dr. Susan Phillips, Department of Public Health.
Questions for the chief?
There are no questions for the chief.
Okay.
Dr. Phillip, your first question is from Loy Almiron, Mission Local. Why does the city have the capacity to do 4,300 tests a day, but is only doing 700 or so? Why not use the unused capacity to test at congregate living places?
Great, thank you for the question and the opportunity to elaborate. We think testing is a really important component of our moving forward, as we outlined in the 5 indicators that we're going to look at. So while we do have 4,300 test slots available in our laboratories that we directly work with, both at our public health laboratory, at the clinical laboratory at Zuckerberg San Francisco General Hospital, and with our partners at UCSF, we also need to match that test with collection supplies. So we need to actually get the specimen from the patient, take it to the laboratory to be run within that capacity. So both of those numbers have to match. Until last week, we were having real challenges with our supply of testing specimen collection materials to do the tests. That has improved, and so now we are more able to ramp up testing. So one of our main goals is to increase that number. The 700 number that was cited, that you cited, is higher than it has been a week ago or days ago. So we're heartened by that, but we need to continue to increase that. So people should, now we have recommended that people can access testing for a wide range of symptoms that are compatible with COVID-19. They also should access testing if they speak with one of our skilled investigators and are told that they may have been a contact to a person with COVID-19. So with both of those expansions, we are anticipating that testing will increase. We are also focused on trying to ensure safety for populations in congregate settings. Testing is one part of that. It is not the only part. There's a lot of prevention work that our teams are also doing in those settings. But again, expanding testing to those sites is also a priority. So you will see the numbers reported of tests completed in San Francisco residents go up over the coming days and weeks.
The next question is from Wilson Walker, KPIX. In regard to the city testing well below its current capacity, do you think San Franciscans are aware of the testing opportunities now offered by the city?
Great, yes, and again, another good opportunity to reinforce and clarify the importance and the increased access that we're promoting now to testing. So it's only been within the last week that we have increased or expanded the symptoms that would qualify someone for testing, and we've also brought online more testing capability within the city. I want to remind people that testing may also be quite available through their own providers. There are private providers in the city that have access to testing and the ability to get those results back in much faster time than was true even a few weeks ago or months ago. And so that is important to understand and continue. The city also has expanded options for testing, including our City Test SF sites, which are really important for people to know about. They're located in two places. One is at Piers 30 and 32 on the Embarcadero, and the other is in Soma at 7th and Brannan Streets. And people are able to go online through SF.gov and sign up to have testing there without requiring a provider's authorization if they're not able to easily access a test in any other way. So people who are experiencing any of the symptoms of COVID, people who are contacts, have that additional option now to get tested. So this is a good opportunity to make San Franciscans aware that those resources are available to them in addition to their routine care at their provider.
The next question is from Joshua Sabatini, San Francisco Examiner. Dr. Phillip, under the health order, can the city's golf courses open as early as next week? And are people permitted to play tennis under the new health order as well?
So the answer for golf courses is yes. People are able to utilize golf courses, and those can be open under the new health order next week. For tennis and other sports that utilize shared equipment, even though people are able to maintain their own physical distance, they're sharing the ball, and so tennis would not be allowed.
The next question is from Janie Har, Associated Press. There appears to be some confusion over whether summer camps are allowed under the new health order. Are summer camps allowed?
So childcare provision or recreational activities such as summer camps are allowed to provide childcare for workers who are doing essential work, including under the broadened definition of these orders. Those providers, though, will have to really be able to demonstrate that they can provide this in a safe way, allowing for distancing, environmental cleaning, separation, face covering, and in dedicated groups of small numbers of children with dedicated caretakers and teachers. So the answer is yes, but there are caveats to that in order to keep people safe.
Next question, Joyce Cutler, Bloomberg Law. How will the city enforce safe distance orders on construction sites?
Those will be done through the Department of Building Inspection.
And is the city presuming workers coming down with COVID-19 were exposed on the job?
So for people who develop COVID-19, who are tested and are positive, we interview every single one of those people as part of our case investigation and contact tracing work that you heard as another pillar of the work that we need to build up and be ready to do as we loosen the shelter-in-place orders further into the future. So we would be interviewing people, and we would, through that interview, try and understand, was this a result of a workplace exposure or a result of a community-based exposure? So we would do further investigation before assuming that it was or was not.
Final question is from Eve Beatty, Eater SF. Can you please explain why some outdoor businesses, like flea markets, have been cleared to open while restaurants with outdoor seating have not?
Yes, and I want to remind everyone that these orders were regional orders, and that's very important because as all of the orders have been, taking this regional approach really ensures that we have the best possible outcomes and reductions in infections, since we all cross across county lines here in the Bay Area so often. So this was a regional approach decided by the health officers. For flea markets and other outdoor markets such as that, the transaction can happen with relatively a small amount of contact, and both the seller and the buyer can wear masks the entire time. For a restaurant, even if they were able to do spacing of the patrons, space them out, it's very difficult to maintain spacing for the server, for the actual restaurant employee. And in addition, in order to eat and sit down and eat at the outdoor space, people are removing their masks. And so that sort of combination of risks to the workforce and the risk potentially to other patrons with having masks removed in that area was the reason that restaurants' outdoor spaces were not allowed under the new order.
And to follow up, what progress has been made to determine additional health code regulations for restaurants when they do reopen?
Yes, so I think that will be in progress over the next month, and there are steps that restaurants and other businesses can take now, and many have adapted their models to really focus on takeout or delivery, but they're models that can be put in place to think about spacing for patrons when that is allowed, for ways in which the wait staff and other restaurant workers can also be kept safe. So there'll be more guidance and information to come specifically to restaurants.
Thank you, Dr. Phillip.
you.
The next question is for Director Abigail Stewart-Kahn, Homelessness and Supportive Housing. Director Stewart-Kahn, question from Carrie Sisto Hoodline. If the RVs will be reserved for the Bayview Hunters Point community, what resources will be offered to the homeless community throughout the city and growing in the Tenderloin community?
I think you heard part of this answer from Director Rohr of the Human Services Agency, but thank you for the opportunity to expand further. I want to underscore, because part of the values of the Department of Homelessness and Supportive Housing are to be as honest as possible with people experiencing homelessness. I want to underscore that while unsheltered homeless individuals are on the priority list for the city to move into hotels, and we are working as fast as we possibly can to stand up more hotels, those resources are limited, and standing up hotels is a significant piece of work. So what I want to underscore is that while we know all San Franciscans and vulnerable residents are really suffering, it's really important that those who have been in San Francisco, who have roots in San Francisco, and who are known to our homelessness response system, these are individuals who have been waiting sometimes for years, 10 years, on our streets to get help. These are the individuals that we will be looking for when we do have rooms available. And while we are looking for vulnerable individuals based on age and medical conditions, as we've discussed many times, and we need all of our counterpart sister communities to be doing the same kinds of work, and we know that they are. We talk with them twice a week, and we know that hotels are part of the plan for all of the surrounding areas. And so if you're experiencing unsheltered homelessness in San Francisco and you are not from here and you are not known to our system of care, you are not going to be able to move in quickly to a hotel room in San Francisco. That's part of the honesty that I really need to provide you, and you heard it from the mayor today, and I want to underscore it. It's not that we don't want to help you, it's that it will take tremendous amount of time, and we need you to return to your home communities and get the resources there. So we will be placing people in our system who are known to our system who are vulnerable. To the specific question around geography, so we have lots of different ways we're looking for people. We're looking based on vulnerability, looked at, are they known to our system, and do they have San Francisco roots? And finally, where are they located? And this is similar. We know where people are experiencing unsheltered homelessness, and we know where it's increasing. It is increasing in the Bayview, hence the RVs. It is increasing in the Tenderloin. Hence our focus on the Tenderloin in the coming 2 weeks to move people from that community who have been unsheltered in that community historically into hotel rooms. And we will be looking at impacted neighborhoods across the city with that same lens.
Thank you. That concludes our questions for today's press conference.